My name is Yasrin Elmi. I volunteer at Diabetes UK. This presentation has been designed as a guide to managing diabetes during Ramadan. The presentation has been approved by clinical advisors at Diabetes UK and imams based in London. Introduction to Ramadan. Ramadan or Saum is one of the 5 pillars of Islam. Fasting during the month of Ramadan means abstaining from food, drink, and several other things for 30 days. Most people take 2 meals, one meal before dawn known as Sehri and Iftar, the meal after sunset. The month of Ramadan follows the lunar calendar, so fasting is brought forward by 10 days each year. This year it will begin on the 9th of July, followed by celebrations known as Eid al-Fitr. Who is exempt? According to the Quran and Sunnah, there are certain groups of people and circumstances where you may be exempt from fasting. For example, children under the age of puberty, the elderly, the sick, those with learning difficulties, those who are travelling, pregnant, breastfeeding, and menstruating women. However, should any one of you be sick or on a journey, then he should fast a number of other days equal to the ones missed. In Surah Baqarah, Ayah 184, and as for those who fast with difficulty, they have a choice either to fast or to feed a poor person for every day. The impact of fasting on the body. For someone who is fasting, it is the norm to feel hungry, thirsty, and lethargic, but this is often exaggerated in those with diabetes. Usually your body enters into a fasting state 8 hours after the last meal. From this time onwards is when you are most likely to display symptoms of hypoglycemia. This may cause some difficulties in maintaining your blood glucose levels. Later on in the fast, your body will break down your fat stores for energy. If you have a blood glucose meter, it's important that you check your blood glucose levels regularly during fasting. Potential risks when fasting. Risks of fasting with diabetes include hyperglycemia, hypoglycemia, and dehydration. Hyperglycemia, when glucose levels are too low. Symptoms include shaking, sweating, blurred vision, tingling of the lips, irritability, anxiety, fast pulse, palpitations. Not all people with diabetes will be at risk of hypos, only those with insulin or using certain medications. Hyperglycemia, when glucose levels are too high. Symptoms include thirst, increased urination, headaches, extreme tiredness, and ketones, which causes a pear drop smell on the breath. This only occurs in people with type 1 diabetes. Dehydration. Symptoms include feeling more thirsty, decreased urinary output, dry mouth, lips, and skin. Remember, testing your blood glucose levels doesn't break your fast, so if you have the facility, test regularly. What are my options? Ideally, you should visit your doctor 2 months prior to Ramadan or at your annual diabetic review to discuss your options and review your medication. Healthcare professionals may categorize patients who would like to fast during Ramadan as either high, moderate, or low risk. If you are advised by your doctor not to fast, then it's important you take this into consideration. Acknowledge that your GP has some understanding about your health and appreciate this. It may be a good idea to do a couple of days in the month prior to Ramadan, Sha'ban, to see if one is capable of completing it without any complications. In some areas, there are education programs focusing on managing your diabetes during Ramadan. Patients who have attended this education program have had a significant decrease in hypoglycemic events. How do I manage my diabetes? It is important to always take your medication with your food, and during Ramadan, a suitable medication plan needs to be devised with your healthcare professional. Without discussing your medication with a healthcare professional, you may be at risk of hypos and hypers. A study found that the change in eating patterns during Ramadan increased the risk of severe hypoglycemia. Rigorous exercise is not recommended as the risk of hypos may be increased. If the patient suspects they have symptoms of hypoglycemia, they should break their fast. In Surah Baqarah, Ayah 195, make not your own hands contribute to your destruction. So it is important to look after yourself during Ramadan. If at any point you feel ill, break your fast. Food choices. It is good to maintain a healthy diet during Ramadan. Before and after fasting, include high fiber foods such as whole grain cereals, brown bread, brown rice, beans, pulses, fruits, vegetables, and salads. Foods high in saturated fats should be avoided, such as ghee, samosas, or pakoras. Healthy ways to break your fast include a handful of dates and some water. Take-home messages. Testing your blood glucose levels is important and it does not break the fast. If you have a blood testing meter, test your glucose levels regularly. Consult your GP in advance. Look for signs of hyperglycemia, hypoglycemia, and dehydration. Remember that not all people with diabetes will be at risk of hypos, only those with insulin or on certain medications. Make sure someone you know is aware that you are fasting. It is really important to do this because if you go into a hypo or a hyper, then they would be able to respond more quickly. Always carry glucose tablets, glucose gel, or a sugary drink. This may need to be followed up with a snack, such as a piece of fruit, biscuit, or half a sandwich. Finally, if you are ill, it is important that you break your fast. Here are some references. For further information, you can contact Diabetes UK. Thank you for listening to this presentation. I hope you found it useful.